Hi guys, good morning. I am Jessica Maderazo and today I will be discussing the topics which are all about the coronary artery diseases, cardiac surgery, and vascular diseases. So first is the coronary artery disease or also known as CAD. Under coronary artery disease, we have three subtopics which are atherosclerosis, angina pectoris, and myocardial infarction or MI. Etiology and pathophysiology of coronary atherosclerosis. So ano nga ba yung coronary atherosclerosis? It is the deposition of fatty plaques along inner wall of coronary arteries that leads to inflammation. So ito yung isang situation kung saan yung fats ay nag-a-accumulate dun sa inner wall ng ating coronary arteries. And kapag nag-accumulate na yung fats na yon, doon na magkakaroon ng fatty plaques. Which can lead into further damage do sa ating arteries. And syempre, yung fats na yon is hindi naman normal na andon sa wall ng arteries natin. And dahil doon, i-consider siya ng katawan natin as foreign object. And kapag may foreign object, pwede mag-cause yun sa infection or inflammation. And as a reaction ng katawan natin, magpapadala siya ng macrophage to fight for the inflammation. Ang kaso, hindi naman magiging effective si macrophage para ma-eliminate yung fatty plaques na present na doon. Ang mangyayari lang, mas kakapal lang yung fatty plaques na andon kasi babalot lang siya doon sa ibabaw nun. Pero wala namang mangyayari doon sa fatty plaques na andon, hindi pa rin mawawala. And kakapal lang siya. And in turn, mas malaking obstruction na present dun sa wall ng artery natin. And kapag nagkaroon na ng ganong kakapal na obstruction, dun na mangyayari yung narrowing and possible obstruction na magli-lead into decreased blood flow papunta sa ating peripheral and cerebral vessels. Next is the angina pectoris. So, ano nga ba ang angina pectoris? It is an episodic pain experienced when the blood oxygen level cannot meet metabolic demands of muscles. It occurs when the heart muscle doesn't get much enough blood as it needs. So, kung atusin, itong angina pectoris at atherosclerosis ay magkakaugnay. Kasi, when we talk about atherosclerosis, ito yung obstruction do sa artery natin, do sa wall ng artery natin dahil dun sa fatty plaques. And kapag nagkaroon na ng obstruction, syempre yung dugo hindi na magiging maayos yung flow papunta dun sa part ng ating katawan and maging sa ating heart. And kapag nangyari yun, syempre yung blood ay yung main carrier ng oxygen. And kapag decreased ang blood flow, magkakaroon ng angina pectoris. Kasi decrease na yung oxygen na natatanggap nung muscle ng heart. In addition to atherosclerosis, this temporary ischemia may be precipitated by coronary artery spasm or contraction. Strenuous exercise, heavy meals, hyperthyroidism, exposure to cold, and emotional stress. Yung angina pectoris daw ay maaaring matrigger ng strenuous exercise, heavy meals, hyperthyroidism, exposure to cold, and emotional stress. Kasi nga 'di ba, kapag halimbawa nag-exercise ka tapos sobrang strenuous ng exercise mo and decrease na yung blood flow na nagdadala ng oxygen. So mahihirapan na si heart kasi magiging mataas during your exercise, magiging mataas yung oxygen demand ng katawan mo. And si heart nga is hindi na enough yung blood and oxygen na natatanggap. So matitrigger na magkaroon ka ng angina pectoris. Doon tayo sa classification ng angina pectoris. First is the stable. It is the pain or discomfort that most often occurs with the activity or emotional stress. So, ito yung isang uri ng angina pectoris na nangyayari kapag tayo ay may mga mabibigat na gawain ginagawa and kapag stress tayo. So, paano nga bang mangyayari na magkakaroon ng angina pectoris kapag tayo ay may mga mabibigat na gawain ginagawa? Siyempre, kapag pagod na pagod tayo, tumataas yung level of oxygen requirement ng katawan natin. And kagaya na nga na sinabi, kapag may angina pectoris, decrease na yung oxygen na natatanggap ng muscle ng heart natin. And kapag tumaas pa yung requirement na oxygen ng katawan natin, mas mahihirapan na si heart to perform its function. Next, doon na tayo sa unstable angina, or also known as the pre-infarction. It is defined as one or more occurrence of chest pain similar to the STMI that can occur within 24 hours of infarct onset. So, ito yung isang uri ng angina na hindi lang isang beses umaatake. And nangyayari ito during the 24 hours of infarct onset. So, ano nga ba yung pagkakaiba ng stable and unstable angina? So, stable angina is when you get angina symptoms during moderate physical activity or when you are pushing yourself physically. These symptoms go away with rest or medication. While on the other hand, unstable angina is when you get angina symptoms while doing very little or resting. So, madali lang naman siyang tandaan. Kapag stable, nangyayari yung angina pectoris kapag pagod tayo or may mga mabibigat na gawain tayong ginagawa. While yung unstable angina naman, nangyayari siya kahit wala kang ginagawa or kahit nakapahinga ka. Next is the intractable or refractory angina pectoris. It is a condition in which patients' heart continue to suffer from recurrent restricting angina even though they are following the right medication plan. So, yan yung isa sa mga pinakamahirap na gamutin na angina pectoris kasi kahit na sumusunod na yung pasyente or nagkakaroon na siya ng maayos na medication, nangyayari pa rin siya. Nagkakaroon ng recurrent. Next is the Prince-Metal. This type of angina is caused by a sudden spasm in coronary artery, which temporarily narrows the artery. This narrowing reduces blood flow to your heart, causing severe chest pain. Prince-Metal's angina most often occurs at rest, typically overnight. Attacks tend to occur in clusters. So, itong Prince-Metal na to, ito yung isang uri ng angina na nangyayari due dun sa spasm or dun sa contraction ng coronary artery. And, syempre, kapag nagkaroon ng spasm or contraction dun sa coronary artery, magkakaroon na ng decreased blood flow. And, syempre, kapag decreased yung blood flow, decrease na rin yung level of oxygen na darating dun sa muscle ng heart natin and even dun sa different parts of our body. So, para siyang unstable angina din. Nangyayari din siya during rest and karaniwan daw umaatakin ay overnight. Etiology and pathophysiology of myocardial infarction. Myocardial infarction, or also known as heart attack, is the irreversible death or necrosis of heart muscle secondary to prolonged lack of oxygen supply, or also known as ischemia. This is usually the result of a blockage in one or more of the coronary arteries. A blockage can develop due to a buildup of plaque, a substance mostly made of fat, cholesterol, and cellular waste products, or due to sudden blood clot that forms on the blockage. So, itong myocardial infarction is the irreversible death. Kapag sinabing irreversible, once na namatay na yung muscle na yun, hindi na siya babalik sa dati. So, paano nga ba nangyayari yung myocardial infarction? So, kung i-analyze mo ng maigi, yung atherosclerosis, angina pectoris, and myocardial infarction is interconnected. Halimbawa, yung isang tao may atherosclerosis. So, may obstruction dun sa wall ng artery niya. Kapag may obstruction, decreased yung blood flow. Pag decreased yung blood flow, decreased din yung oxygen level na dadating dun sa muscle ng heart natin. Kapag decreased yung oxygen na yon, nagkakaroon ng ischemia. And kapag nagkaroon ng ischemia, or yung prolonged lack ng oxygen, dun na mamamatay yung muscle ng heart natin. Kapag namatay yung muscle ng heart natin, nagkakaroon ng scarring. So, kapag nagkaroon ng scarring, yung part na yon hindi na siya nagagamit sa pag-pump ng blood. So, isipin mo kung ang laki na nung part ng heart na nagkaroon ng necrosis and scarring, So, hirap na din si heart na mag-pump ng blood. Mahihirapan na siya kasi ang laki na ng part na may scar due to myocardial infarction. And kapag nangyayari yun at hindi na siya nakapag-pump ng maayos ng blood, doon na mangyayari yung heart attack. Next is the risk factors. First is a family history. So, kapag may kapamilya ka na may myocardial infarction, angina pectoris, or even yung atherosclerosis, most likely mataas yung probability or yung chance mo na magkaroon ka din nun kasi namamana siya. Next is the increasing age, particularly in women. So, bakit nga ba? Kasi, kapag tumatanda ang isang tao, nag-harden yung mga arteries, at pag nag-harden yun, impaired na rin yung vasodilation niya. And, yun yung magli-lead para magkaroon isang tao ng hypertension. So, ano nga bang role ng hypertension kung bakit nangyayari ito? So, the higher the pressure and volume of blood, the more yung pumping effort na exert ng ating heart para lang mag-flow yung ating blood papunta sa different parts of our body. And kapag yung hypertension remains untreated for a long time, darating yung oras na yung muscle ng heart natin ay mag-enlarge and mag-weaken. And syempre, ganun din yung arteries natin. Kapag gamit na gamit siya, mag-weaken din yung muscle niya and hindi na niya mape-perform ng maayos yung kanyang function. Next is the cigarette smoking. Cigarette smoking contributes to vasoconstriction, platelet activation, arterial smooth muscle cell proliferation, and reduced oxygen availability. Siyempre, alam naman natin na yung sigarilyo talaga, nagko-contain yan ng napakaraming harmful substance sa ating katawan. And bakit nga ba nangyayari yun? Ano nga bang role ng cigarette smoking? Kasi yung nicotine and carbon monoxide sa cigarette smoke ay nagda-damage ng endothelium. And kapag na-damage yung endothelium natin, doon na magsisimula yung plaque formation. Kapag nagkaroon ng plaque formation, doon na mangyayari yung obstruction sa normal blood flow. Next is the gender. Especially after menopause, estrogen seems to provide some protection. Race, risk appears higher in African Americans. And next is the hyperlipidemia. Increased total cholesterol or increased LDL or low density lipoprotein. So, ano nga ba ang role ng hyperlipidemia? So, yung low density lipoprotein kasi, kapag mataas yan, diyan magmumula yung plaque formation. Bakit? Kasi yung LDL or yung low density lipoprotein, yan yung cholesterol na itinuturing natin as bad cholesterol. Kasi kapag mataas yung amount niya sa blood natin, yan yung kumakapit do sa wall ng arteries natin. And dyan yung nagpo-form ng plaque para magkaroon ng obstruction na nag-i-impair do sa normal blood flow. So, hindi maganda na mataas yung amount ng low density lipoprotein o yung bad cholesterol. Next ay ang obesity or particularly yung abdominal obesity. Overweight people have high level of artery clogging o LDL cholesterol. And syempre kapag mataas yung cholesterol mo, yun yung magkukos ng plaque. So, yun yung magkukos ng plaque build-up. And syempre, kapag nagkaroon ng plaque build-up, obstruction na naman yun doon sa normal blood flow. Another is, obese people have increased blood volume that will always lead to hypertension. Sedentary lifestyle. Sedentary lifestyle contributes to obesity and reduced HDL. So, syempre kapag lagi lang tayo nakaupo, wala tayong ginagawa, hindi man lang tayo naglalakad-lakad, or hindi tayo nag-exercise, more likely magiging obese tayo. And syempre, obesity plays a important role kung bakit nagkakaroon ng myocardial infarction ng isang tao. Next is the type 2 diabetes. Type 2 diabetes drives inflammation and slowing blood flow. So, syempre, dun nga sa atherosclerosis, 'di ba? Kapag nagkaroon ng accumulation ng fats, nagkakaroon ng inflammation. And ang pinakang role daw ng type 2 diabetes kung bakit isa siya sa risk factor ay mayroon siyang slow blood flow. And kapag slow yung blood flow ng isang tao, mas mataas yung chance na yung cholesterol na present dun sa blood natin is kumapit dun sa wall ng arteries natin. And yun yung tinatawag nating plaque buildup o yung atherosclerosis. Next is the stress. Stress, an innate, competitive, aggressive type A personality seems less important than amount of stress in client's psychological response. So, bakit nga ba may naging isa rin sa risk factor ang stress? Kasi kapag may chronic stress daw, it will lead to lipid metabolism imbalance, and kapag nangyari yun, magkakaroon ng hyperlipidemia. So, katulad na sinabi ko, kapag may hyperlipidemia, mataas yung LDL o yung bad cholesterol, mas mataas yung chance na magkaroon ng plaque formation. So, yun yung stress daw. Kaya hindi pala maganda sa kalusugan ng isang tao rin na masyadong nai-stress. Naglilid kasi siya sa lipid metabolism, and pag nangyari yun, nagkakaroon ng hyperlipidemia. Next is some research study also says that yung high levels of cortisol from long-term stress can increase blood cholesterol and blood pressure. So, di ba kapag stress na stress tayo, nag-release yung katawan natin ng hormone na tinatawag na cortisol. So, yun daw, kapag daw long-term na, mayroon tayong long-term na stress, nagkakaroon ng increased blood cholesterol and blood pressure from the cortisol that is being produced by our body as a response dun sa stress. Next is the metabolic syndrome, or it is the cluster signs including hyperlipidemia, low HDL level, or yung high density lipoprotein, abdominal obesity, increased BP, insulin resistance, increased levels of reactive protein, and increased fibrinogen level. So, yung metabolic syndrome na yan, katulad doon sinabi ko kanina, kapag halimbawa mataas yung low density lipoprotein or yung bad cholesterol, yun most likely magkakaroon talaga ng plaque formation. And yung obesity, increased BP, yung insulin resistance, do sa under yan ng type 2 diabetes. And yung increased fibrinogen level. Next, doon na tayo sa clinical findings or yung mga nararamdaman ng isang taong may myocardial infarction or yung angina pectoris. First is the subjective. Under the subjective, we have the retrosternal chest pain that may radiate to arms, jaw, neck, shoulder, or back. It is the pain described as a pressure, crushing, or vice-like palpitations, apprehensions, feeling of dread or impending doom, dyspnea, nausea, vomiting. Pain of angina can be associated with activity and generally subsides with rest. Commonly asymptomatic with silent ischemia. Another atypical symptoms of angina in women include exertion-related discomfort above waist, burning or tenderness to touch in back, shoulders, arm, jaw, abdomen, overwhelming fatigue, indigestion, and feeling of unease. So, doon na tayo sa objective data, kung saan ito yung mga makapagpapatunay na yung isang taong yun ay may myocardial infarction, angina pectoris, or yung atherosclerosis. First is the ECG. So, ECG changes may reveal ischemia or inverted T-wave, elevated ST segment, or evidence of MI with presence of Q-wave. A Holter monitor may be used to detect changes associated with activities of daily livings or ADLs. Second is yung elevated levels of serum enzymes and isoenzymes with MI. First dyan is yung cardiac troponin. Levels increase within 3 to 6 hours and remain elevated for 14 to 21 days. Yun ay accurate para ma-assess yung myocardial damage. Second is yung cardiac troponin. Levels rise 7 to 14 hours after an MI and remain elevated for 5 to 7 days, specific for myocardial damage. Third is the creatinine kinase. Levels elevate 3 to 6 hours after infarction, peaking at 24 hours and returning to normal within 72 hours. Next is the MB isoenzyme and of creatinine kinase. Levels elevate 4 to 6 hours after pain, peaking within 24 hours and returning to normal within 72 hours. Yan ay specific for myocardial damage. And last, yung myoglobin levels elevate in 1 to 3 hours, returning to normal within 12 hours. Next, dyan sa mga objective data is yung C-reactive protein. Elevation suggests inflammation of the vascular endothelium and coronary artery calcification. So, automatic na kapag mataas yung C-reactive protein, ibig sabihin may nangyayaring inflammation doon sa vascular endothelium. Katulad na lamang kapag mayroong atherosclerosis. Next is the Doppler flow study. Doppler flow study is a type of ultrasound. It uses sound wave para malaman or ma-measure yung amount of blood na nag-flow dun sa blood vessel. Next naman is yung cardiac nuclear scanning or thallium multigated acquisition scan or echocardiographic studies na nag-help para ma-determine yung extent of vessels na involved dun sa myocardial infarction. So, yung nuclear scanning na yan is a non-invasive diagnostic procedure that uses small amount of radioactive material to create images of your heart. So, yan daw cardiac nuclear scanning na yan, inagamit yan para makita kung gaano na, halimbawa, para makita kung gaano na kalaki yung damage na nangyayari due to myocardial infarction. So, pwede siya makapag-produce ng image kung aling part ng heart natin yung mayroong necrosis. Next is the sympathetic nervous system responses such as yung pallor, tachycardia, diaphoresis, and vomiting. So, yung pallor or yung paleness. Siyempre, kapag decrease na yung blood flow, magkakaroon talaga ng paleness kasi decrease na rin yung blood na napunta sa ating katawan. Tachycardia. So, bakit nagkakaroon ng tachycardia? Siyempre, kapag na-detect ng katawan natin na decreased yung blood and yung oxygen na natatanggap ng ating katawan, ang mangyayari, i-command niya si heart na mas mag-pump pa and mas mag-work pa and mas mag-exert ng effort para mag-flow yung blood. Kaya nagkakaroon ng tachycardia o yung pagbilis ng tibok ng puso. Next is the diaphoresis. So, bakit nga ba may diaphoresis ang mga taong may myocardial infarction o yung may angina pectoris? It is due to cut off of oxygen rich in blood to the heart muscle. Therefore, yung body natin uses more energy to supply blood and cool itself down, which makes us sweat. Next is the signs associated with MI or yung dysrhythmia, elevated temperature, elevated sedimentation rate, and increased WBCs. So, yung elevated sedimentation rate, yan ay isa sa mga indicator ng inflammation. Another is increased WBC or yung white blood cells. Kasi 'di ba yung white blood cells, ayan ang pinakang role niyan is to fight yung infections na nangyayari sa katawan. So, kapag increased yun, ibig sabihin, may inflammation or may infection na inalabanan yung ating katawan. Next is the therapeutic interventions. Doon muna tayo sa prevention of myocardial infarction. Supervised exercise program to avoid ischemia but promote collateral circulation and increased HDL. Weight control, smoking cessation, dietary restriction of sodium, cholesterol and total and saturated fat, management of hypertension, hyperlipidemia, and diabetes. So, mahalaga daw na kahit pa konti-konti magkaroon tayo ng proper exercise, kahit ba yung mga simpleng exercise lamang para pawisan tayo, para lang hindi tayo maging obese. So, mahalaga yun para maiwasan natin magkaroon ng myocardial infarction. Next is yung weight control nga. Mahalaga talaga yun para syempre hindi tayo maging obese. Kasi yung obesity, di ba, isa yan sa pinakang risk factors na pagkakaroon ng mga heart diseases. Next is the dietary restriction of sodium. So, bakit na kailangang restricted lang yung intake natin ng sodium? Kasi yung sodium is linked to water retention. And kapag nagkaroon ng water retention, it will trigger the increase in blood volume that will lead into hypertension. So, syempre, di ba, sabi natin kanina, yung hypertension, isa yan din sa mga risk factors. So, next to sa prevention ng myocardial infarction is yung pharmacologic management. So, una dyan is yung nitrates. So, ano nga ba yung nitrates na yan? Yan yung mga gamot na may direct relaxant effect sa mga vascular smooth muscles natin. Ang role niyan is for dilatation. Ang example niyan ay yung halimbawa niyan ay yung nitroglycerin. Next is the beta-blocking agents. So, ano nga bang role niya mga beta-blocking agents na yan? Yan yung mga gamot na naglo-lower ng blood pressure natin by blocking the effects of the hormones epinephrine. And kapag nangyari yun, magiging slower na yung pagpapump ng heart natin na magli-lead dun sa decreased blood pressure. Next naman is the calcium channel blocking agents. Yan naman is yun yung mga anti-hypertensive, and yung mga example niya is yung amlodipine, diltiazem, felodipine. Basta yung mga anti-hypertensive. Next is the anti-lipidemic. Yan yung mga gamot na nag-promote ng reduction of lipid levels in the blood. May mga anti-lipidemics naman na nag-lower ng level ng LDL, and meron naman na nag-increase ng LDL. Yan yung para sa di ba yung hyperlipidemia ay isa sa mga risk factors. So, para yan dun sa na yan, para ma-prevent yung myocardial infarction. Next is yung antiplatelet. Yan yung antiplatelet ay yung mga medicines na inatulungan yung katawan natin to stop cells in the blood platelet from sticking together and forming a clot. Ang mga halimbawa niyan is yung aspirin. Yan yung pinakang common na example ng antiplatelet. Next is the angiotensin converting enzyme inhibitors. Yan yung mga medication naman na nag-cause ng relaxation of blood vessels that will lower the blood volume. Kasi diba kapag constricted yung blood vessels natin, elevated din yung blood pressure. And kapag naka-relax o naka-dilate yung ating blood vessels, lower din yung blood volume. And yung angiotensin converting enzyme inhibitors na yan yung pinakang main function niya. To lower the blood by relaxing the blood vessels. Kapag lower na ang blood volume, lower na din yung blood pressure. And hindi na mapiprevent na yung pagkakaroon ng hypertension. Next is the supplemental oxygen during anginal attack as needed. Percutaneous coronary intervention or PCI such as percutaneous transluminal coronary angioplasty, coronary artery stent placement, and atherectomy to revascularize myocardium. Yan yung procedure kung saan mag-i-insert ng catheter para yung obstruction, para alisin yung obstruction do sa specific area na mayroong plaque formation na nag-obstruct para ma-impair yung normal blood flow. Next is the coronary artery bypass graft or CABG if medical regimen not successful. So yan yung yung CABG o yung coronary artery bypass. Yan yung yung kukuha ng ugat do sa may chest, sa may wall ng chest natin or do sa may hita natin para siyang ipalit dun sa artery na hindi na nagpa-function dahil obstructed na siya. So, from the word itself, bypass, iba-bypass niya yung artery na may obstruction. Then, i-connect yung kinuha na ugat doon sa part ng katawan natin, papunta doon sa kasunod na part na walang obstruction para magkaroon ng supply ng blood para ma-prevent na yung further necrosis. Kasi pag nagtuloy-tuloy pa yung decreased blood flow, mas magkakaroon ng malaking damage. Kaya gagawin yung CABG para maagapan na hindi kumalat yung necrosis. Next is sa management of acute myocardial infarction. So, ang pinakang priority natin dyan kapag mayroong myocardial infarction is to improve perfusion. So, ano nga ba dapat natin gawin agad? So, first is we need to administer aspirin immediately. Yan yung mga medication na inagamit to dissolve blood clot and improves blood flow. Next is the beta blockers or angiotensin II receptor blockers for left ventricular systolic dysfunction. Next naman ay yung thrombolytic therapy within 30 minutes of arrival. So, ano nga ba itong thrombolytic therapy na ito? So, ang thrombolytic therapy na yan is also known as fibrinolytic therapy, kung saan ina-breakdown natin yung blood clot sa pamamagitan ng medication. Next is anticoagulants or blood thinner. So, yan yung medication na yan, kailangan natin i-administer yan para ma-prevent yung further na pagkakaroon ng blood clot na maaring dumagdag dun sa obstruction. Kasi yung anticoagulant na yan, yan yung tinatawag natin blood thinner na nag-prolong ng clotting time. Next is the IV nitroglycerin and angiotensin converting enzyme inhibitor. Next naman, do sa management ng acute myocardial infarction is the promotion of comfort and rest. So first, analgesics. Kailangan natin mag-administer ng analgesic katulad ng morphine to reduce pain, anxiety, and cardiac workload by decreasing preload and afterload. Next is oxygen to improve tissue oxygenation. Kasi nga, di ba, kapag may mga myocardial infarction, decrease na yung blood flow, impaired na yung normal blood flow, and syempre, decrease na rin yung oxygen na natatanggap ng katawan natin. So, kailangan nating mag-administer ng oxygen sa kanila. Kasi yun yung pinakakailangan nila sa mga panahon na na-atake sila ng ng angina pectoris or nagkakaroon ng heart attack. Mahalaga yung role ng oxygen para mas makayanan ng isang pasyente o ng isang tao yung hirap kapag nagkakaroon ng heart attack. Next is the maintenance of bed or chair rest to decrease oxygen tissue demands. So, kailangan less na yung activity nila lagi. Kailangan ay nasa higaan sila or nakaupo lamang kasi kapag kumilos pa ng kumilos yan or gumawa pa ng mga gawaing mabibigat, i-increase lamang yung level ng oxygen requirement ng katawan natin, wherein mahihirapan yung ating heart na i-produce kasi 'di ba kapag may obstruction, decrease na yung blood flow, decrease na rin yung oxygen, tapos dadagdag pa na kikilos ka pa maigi, mataas lalo yung kailangan na oxygen ng katawan natin, mas mahihirapan yung isang tao na may MI or may angina pectoris. Kaya mas mahalaga na nakarest lang lagi sila para hindi matrigger yung pagtaas ng oxygen requirement ng katawan. Next is the diet therapy. 2 gram of sodium diet or clear liquids depending on presence of nausea. So, yung pag-intake ng sodium talaga kailangan restricted talaga siya kasi yung sodium na yan, katulad na sinabi ko kanina, may role siya sa fluid retention. At kapag nagkaroon ng fluid retention, mataas yung blood volume. Pag tumaas ang blood volume, susunod na yung hypertension, which is napakadelikado, lalo na sa mga taong may MI. Maaring matrigger yung heart attack para mangyari. Next is continuous monitoring. Sa pag-monitor ng pasyente na may acute MI, kinakailangan nating i-monitor yung pulse oximetry or yan yung isang procedure kung saan masusukat mo yung oxygen level in the blood ng isang tao. So, ang normal niyan is 95 above, and syempre kapag below 95 na, kailangan na natin siyang i-refer dun sa kanyang physician para mas maagapan agad. Para may administer yung medication na kailangan niya. Or may administer yung isang procedure na kailangan niya para mapataas yung kanyang level of oxygen dun sa blood niya. Next is the cardiac monitoring, rate evidence of ischemia and dysrhythmias. Vital signs. So, mahalaga na yung vital signs talaga. Hindi natin akaligtaang i-monitor kasi yan yung magiging basis natin kung yung pasyente na may myocardial infarction ay stable yung kalagayan niya. Kasi, syempre, kapag elevated yung BP niya, nasa risk na siya para magkaroon ng another heart attack. So, kailangan nating i-monitor yung BP niya para maagapan agad kung sakaling tumataas yung BP niya. So, mag-administer tayo ng mga antihypertensive drug. Next is the hemodynamic monitoring with pulmonary artery catheter. Next is the assessment for complications of myocardial infarction. First is the dysrhythmias or yung irregular heart rate. So, common na sign na ng myocardial infarction yung pagkakaroon ng dysrhythmia o yung irregular heart rate. Ayan yung pangunahin na ma-assess natin sa isang pasyente na may MI. Next is the cardiogenic shock. It is a condition in which heart suddenly cannot pump enough oxygen to meet your body needs. So, kapag nangyaring cardiogenic shock, kinakailangan agad nating i-report yan sa physician para mag-take action agad sila kung ano yung mga dapat nila gawin para maagapan. Next is pulmonary edema. It is caused by acute heart failure condition caused by the excess fluids in the lungs, making it difficult to breathe. So, bakit nga ba nagkakaroon ng pulmonary embolism? So, nagkakaroon ng pulmonary embolism kasi kapag hindi nakakapag-pump ng yung heart natin efficiently ng blood, yung blood ay mag-back up into the veins that take blood through the lungs. And habang yung pressure na yon ay nag-increase, yung fluid na yon ay mapupush papasok do sa air spaces ng ating lungs. Kapag nagkaroon ng fluid do sa air spaces ng lungs natin, syempre may hirapan yung pasyente na yun na huminga. Kasi hindi na makakapag-inflate or deflate ng maayos yung lungs natin. Kasi puno na siya ng fluid. Next is the thromboembolism or the formation of a clot, also known as thrombus, in a blood vessel and is carried away in the bloodstream to plug another vessel. Clot may block vessel in the lungs na magalid sa pulmonary embolism. Pwede rin siya mapapunta sa brain na pwede mag-cause ng stroke. Pwede rin sa gastrointestinal, tract, and kidney as well as dun sa leg. So, yung thromboembolism na yan, napakadelikado niya na mangyari. Kasi, once na nagkaroon ng thrombus, o yan yung thrombus kasi yan yung clot na pwedeng dumaloy do sa blood vessel natin para mapapunta do sa ibang parts ng katawan natin na kapag bumara siya, madadamage yun. Katulad na lang do sa pulmonary embolism. Kapag bumara yan do sa mga blood vessel dun, yun, hindi na siya dadaloy ng maayos yung blood papunta sa lungs natin. And yung clot na yun, pwede rin siya mag-travel papunta sa brain natin. And yun yung pinakadelikado kasi magkukos yan ng stroke. Kasi syempre pag hindi na dinaluyan ng blood yung certain blood vessels sa brain natin, mamamatay yung mga space na hindi madadaluyan ng dugo dun. Yun ay maglilid papunta sa stroke. Next is pwede rin siya dumaloy sa mga blood vessels na ando sa gastrointestinal natin, ando sa kidney. And kapag nangyari yun, pwede magkaroon ng multi-organ dysfunction kasi decrease na yung blood flow due to the blood clot. Next is the extension of MI. Kasi ang taong may MI, napaka-possible na magkaroon ng extension of MI kasi habang lumalala yung damage or habang mas dumadami yung obstruction na andun sa arteries, mas lalawak din yung area do sa heart natin na magkakaroon ng necrosis due to myocardial infarction. Next is the pericardial effusions or yung pagkakaroon ng too much fluid na natatrap dun sa pericardium natin. So, syempre kapag may fluid, nape-prevent yung heart natin para makapag-pump ng maayos. And it will lead to cardiac tamponade o yung pagkakaroon ng severe compression of the heart. Next, doon naman tayo sa nursing care of clients with coronary artery disease. Doon sa assessment and analysis. First, ang kailangan nating i-assess, syempre, kung may history sila ng chest, arm, shoulder, neck, and jaw pain. Kasi, katulad ng sinabi natin kanina, yan yung pinakapangunahing subjective data na nararanasan ng mga patients with MI or even with angina pectoris. Next is the precipitating factors such as, alibawa, pwede natin silang tanungin, kailan po kayo inaatake? Kailan po nangyayari yung episodic pain na nararamdaman nyo doon sa mga patients na may angina pectoris or doon naman sa mga patients na may MI, pwede natin silang tanungin, kailan po nangyayari yung pag-atake sa yung heart attack na nararanasan ninyo. Pag sinabi ng patient natin na syempre, ay nangyayari yun halimbawa kapag sobrang pagod na pagod ako, kapag ang bigat ng mga gawain ginagawa ko sa bahay, or kapag malamig. So, isa yun sa mga basis na pwedeng magamit natin para magkaroon tayo ng appropriate diagnosis kung saan sila ika-classify na coronary artery disease, kung MI ba yun, kung angina pectoris ba yun. Next is the risk factors na kung saan yun yung mga non-modifiable and modifiable. Pwede natin itanong na ano po yung mga nagsisigarilyo po ba kayo, or nag-e-exercise po ba kayo, or may history po ba kayo sa pamilya ninyo na may coronary artery disease. Kasi pwede rin nating gamitin yun sa diagnosis para masabi na sila ay may MI or angina pectoris. Next is the vital signs. Syempre, hindi yan mawawala sa assessment natin. Kasi, ang kailangan natin i-assess dyan, pwede rin, halimbawa, yung blood pressure, yung pulse rate nila. So, yan, yung vital signs na yan, isa rin sa mga baseline data yan. Talagang hindi mawawala yan para mai-assess natin ng maayos and ma-diagnose yung patient na may possible na coronary artery disease. Next is the input and output of fluid volume. Fluid volume overload is dangerous if cardiac output is compromised. So, kailangan nating i-assess yung kanilang input and output kasi katulad nung na-discuss natin kanina, yung fluid overload ay napakadelikado talaga sa mga taong may coronary artery disease kasi kapag nagkaroon ng fluid overload, mas mahihirapan yung heart natin pump yung blood para makadaloy dun sa ating buong katawan. And maglilid yun sa hypertension, wherein napakadelikado ng hypertension sa mga taong may coronary artery disease as one of the risk factors kung bakit ito na-develop and kung bakit nangyayari or inaatake sila. Next is the adventitious breath sounds and dependent edema with impending failure. So, yung edema, isa rin yan sa pwede nating ma-assess, magamit para masabi kung yung isang tao is may coronary artery disease kasi karaniwan sa mga taong may coronary artery disease may fluid retention. Kaya nagkakaroon ng edema. Next is the restlessness and dyspnea. Dyspnea kasi nahihirapan huminga yung mga tao na may, halimbawa yung mga tao na may extended MI o yung mga tao na nagkaroon na ng pulmonary embolism due to their MI. So, katulad na sinabi ko, kapag yung blood clot na yun, nag-travel do sa different blood vessels ng katawan, lalong-lalo na do sa ating lungs. So, yun, maglilid yun sa dyspnea. May hirapan ng humingi isang tao. Restless na sila kasi kapag may myocardial infarction, decrease lagi yung blood flow, diba? So, yung oxygen na napupunta sa ating katawan is decrease na din. And syempre, kapag decrease yung oxygen natin sa katawan, hinang-hina tayo na wala tayong ganang kumilos. Halos di ka makagawa ng mga gawain sa bahay. Next ay sa skin. Mayroong diaphoresis, pallor, cyanosis. So, Yun nga, nagpapawis ang mga taong may coronary artery disease. And may paleness. Kasi decrease na yung blood na napupunta sa ating katawan. And cyanosis kasi, decrease din yung oxygen na natatanggap ng ating katawan. If MI is suspected, continuous ECG monitoring to detect changes in rate, rhythm, and conduction of impulses, life-threatening dysrhythmias such as ventricular fibrillation and ventricular standstill. Dysrhythmias such as premature ventricular complexes close to a T-wave, ventricular tachycardia, torsades de pointes, or a ventricular tachycardia with a prolonged QT interval that is linked to rapid deterioration and atrial fibrillation. Now, the last topic that I will be discussing is all about vascular diseases. So, under vascular disease, we have subtopics which are thrombophlebitis, varicose veins, and peripheral vascular disease. So, ano nga ba ang vascular disease? So, a vascular disease is any condition that impacts your arteries and veins, harming the blood flow, which in turns harm other parts of the body. So, yung vascular disease daw is yung disease na nakakaapekto sa ating arteries and vein. And, syempre, kapag may problem sa ating arteries and veins, doon na mangyayari yung pagkakaroon ng harm sa blood flow na magkakos ng further damage sa different parts of our body. Next is the etiology and pathophysiology of vascular disease. So first, kailangan muna natin i-discuss kung ano ba ang thrombus and embolus. Mahalaga na alam natin kung ano ang difference between those two factors. So first, thrombus is a clot composed of platelets, fibrin, clotting factors, and cellular debris attached to interior wall of an artery or vein. So makikita natin yung thrombus na yan is also known as blood clots. So yan daw, yan yung nakakita nyo naman, nakakabit siya sa interior wall of our artery or vein. On the other hand, embolus is a clot or solid particle carried by bloodstream and may interfere with tissue perfusion in an artery or vein. So, yung embolus naman is a fragment of blood clot that may travel through our vein. So, tingnan yung pagkakaiba. Yung thrombus is isang buo siyang blood clot na naka-attach do sa wall ng artery natin or vein. Samantala, yung embolus naman is fragment siya or kapiraso ng blood clot na present dun sa wall ng artery or vein. Yung embolus na yan yung pinakang main cause kung bakit nagkakaroon ng isang tao ng thromboembolism. Kasi kapag nag-travel yung blood clot na yan and nag-plug dun sa ibang parts or veins ng katawan natin, doon na magkakaroon ng thromboembolism into a specific part na affected ng blood clot na yan. Kung saang part siya bumara, yun yung part din na maaapektuhan nung kasi ma-obstruct yung normal blood flow. Next is the etiology and pathophysiology of arterial disorders. So, according dito, it involves depriving oxygen to a body part or tissue affected by BP and collateral circulation. So, syempre, kapag mayroong blood clot na nakabara, syempre, una-una, deprived ang oxygen. Bakit? Kasi kapag impaired ang normal blood flow and decreased ang flow ng blood sa katawan natin, deprived yung oxygen na matatanggap ng body part or tissue natin. Kasi nga, blood is the main carrier of oxygen. And kapag hindi natin nakuha yung enough oxygen, maapektuhan yung ating collateral circulation. Next is arterial disorders. First is, so ano nga ba yung mga situation na under ng arterial disorders? So first dyan is yung reduced blood flow resulting from atherosclerosis, thrombus, or embolus. So, yung arterial disorder na yan, as you can see do sa picture natin, sa first picture, 'di ba, decreased or reduced yung blood flow kasi may tatlo siyang pwedeng maging cause. First is yung atherosclerosis or yung obstruction of fatty plaques do sa walls of our artery or brain. Second naman is yung thrombus or yan yung blood clot na nakabarado sa veins or artery. And last is yung embolus or yung fragment ng clot na pwede mag-travel through our veins papunta sa different part ng ating body na pwede niyang maapektuhan. So, next is the lower extremity arterial disease or also known as lead. Yan, ang pinakang main cause karaniwan nito is yung atherosclerosis which can leads to blockage of blood supply to lower legs and feet. So yan, yung mga patients with lead or lower extremity arterial disease ay maaaring maka-experience ng cramps in hips or thigh kasi nga decrease na yung blood flow and yung oxygen na dumarating do sa tissue ng ating lower extremity is decreased na din. So meron na tayong hindi na maganda yung wala na tayong proper tissue perfusion na nangyayari. Then next is leg numbness or coldness. So, syempre kapag hindi na dinadalaw yan ng dugo, nagbabago din yung temperature ng ating katawan kasi mahalaga din ang function ng blood natin in maintaining our temperature. So, isipin mo, hindi na dinadalo yan ng dugo yung part na yun. So, magkakaroon ng coldness and numbness, manhid na. So, syempre, lahat naman tayo nakakaranas na minsan yung kapag matagal na nakabaluktot yung ating binti. So, pag inunot natin parang manhid at saka malamig. Kasi gawa doon sa matagal na pagkakabaluktot hindi na nadadaluyan ng blood. So parang same din yun sa parang ganun din yun sa situation ng lower extremity arterial disease. Next is yung pagkakaroon ng sores on toes, feet, and legs. So, syempre, katulad nga na sinabi natin, kapag hindi na pag nagkaroon ng decreased blood flow, decrease na rin yung oxygen na natatanggap ng tissue do sa specific body part natin. And yung prolonged lack of oxygen will lead to ischemia. And yung matagal na pagkakaroon ng ischemia will lead to the death of the muscle or also known as necrosis. And kapag nagkaroon na ng necrosis, yun na yung mangyayari. Magkakaroon na ng sugat sa paa, sa daliri, and even sa hita natin. Next is Buerger's disease or also known as thromboangiitis obliterans. So, ito is yung isang situation kung saan yung peripheral circulation is impaired by inflammatory occlusions of peripheral arteries. Thrombosis of arteries may also occur. So, the incidence is highest in young adults, males who smoke. So, ito namang Buerger's disease, ayan, kung makikita nyo, mayroong changes do sa kulay ng kamay. So, yan daw, nagkakaroon ng impaired peripheral circulation kasi nagkakaroon ng inflammatory occlusions o yung pamamaga ng ating blood vessel. So, syempre, kapag may inflammatory occlusion na, decrease na rin yung amount ng blood na dadaan doon kasi makipot na siya. So, kapag decrease na yung blood na dumadaan, decrease na rin yung oxygen na mapupunta doon sa tissue ng ating body part, specifically doon sa ating mga daliri kasi sila yung pinakang distant part of our body. So, yung incident daw is highest in young adult males who smoke. So, yan. Makikita nyo, may part ng daliri na merong maputi. Kasi, kaya siya pale. Maputi or pale kasi decrease nga yung blood na dumadaloy. And yung isa naman is bluish kasi decrease na yung oxygen na natatanggap nung tissue na andun sa kanyang daliri. And pwede rin magkaroon ng sore dyan. Parang sa paa din, pwede rin magkaroon ng sore kasi nga, prolonged lack of oxygen may lead to necrosis or death of muscle. Next is yung sa Buerger's disease, yung mga signs and symptoms niya. Yun nga, fingers or toes that appear pale red or bluish. Meron ding cold hands or feet. And pain in the hand that may feel like burning or tingling, yung parang tinutusok ng karayom. And pain in the legs, ankles, or feet. And lastly, yung pagkakaroon ng skin changes or small painful sores on the finger toes or toes. Next naman na disease under arterial disorder is yung Raynaud's disease. So, it is the spasms of digital arteries thought to be caused by abnormal response of sympathetic nervous system to cold or emotional stress, usually bilateral, primarily occurs in young females and continues throughout life. Raynaud's phenomenon is episodic arterial spasm of the extremities secondary to another disease or abnormality. So ito naman, itong Raynaud's disease is nangyayari kapag may spasm o yung contraction of digital arteries. So syempre, kapag nag-contract yung mga arteries do sa digital parts ng ating katawan, is syempre pag constricted yun or nakakontract, decrease na rin yung blood flow na dadaloy. And syempre, decrease na rin yung oxygen na matatanggap ng tissue ng ating mga daliri o kamay. Ayan. So, nakikita nyo naman, yung fingertips ay pale. Una, sa picture, makikita nyo, naging pale muna siya. Kasi decrease na yung blood flow. Kaya pale na, may paleness na. And second, fingertips turn blue due to lack of oxygen. Kasi nga, decrease na yung blood flow. So, decrease na rin yung oxygen na dumadating doon sa part na yon. And once na bumalik na yung normal blood flow, fingertips naman will turn red. Yan, kasi nag-resume na yung blood flow. So, ito daw Raynaud's disease can be caused by cold. Kasi nga, kapag malamig, nagko-constrict yung mga digital arteries natin. And kapag malamig at nag-constrict yun, decrease na naman yung blood and decrease na naman si oxygen. Another thing that contributes in having Raynaud's disease is stress. So kapag we are feeling emotional and being startled, maaari mag-cause yun ng attack sa RP due to the release of nerve transmitter substance, and yung substance na yun can activate certain proteins in our blood vessel which can signal the vessels to narrow. So sabi dito, yung Raynaud's phenomenon daw is episodic arterial spasm of the extremities secondary to another disease or abnormality. So sinasabi na secondary siya into another disease or abnormality kasi nga may mga studies na nagsasabi na it can be linked into some psychological disorders. Kasi nga natitrigger siya ng stress. And then, next is, doon naman tayo sa venous disorders. So, venous disorders are conditions that damages your veins. So, yung veins, yan yung mga blood vessels na nagkikarry ng deoxygenated blood from your organs and tissue back to your heart. So, mahalaga na tandaan natin yung pagkakaiba ng veins and artery. Kapag vein, carry blood vessels that carry the oxygenated blood from your organs and tissue back to the heart. Kapag naman artery, blood vessels that carry oxygenated blood towards our organs and tissue. Basta pag veins, towards our heart, and kapag naman artery, away from our heart. So, under the veins, yung ating pathophysiology dito may include impaired smooth muscle around vessels. So, nagkakaroon ng mga venous disorders kasi nagkakaroon ng changes dun sa smooth muscles around vessels. So, kapag nagkaroon ng impaired smooth muscles, yung thin smooth muscle in the vein helps squeeze blood back towards the heart, and kapag hindi na sila ganong nagko-constrict, hindi na rin sila gaanong nakakapag-squeeze ng blood pabalik dun sa ating heart. So, kumbaga, kapag hindi na sila nakakatulong masyado sa pag-squeeze ng dugo pabalik sa heart, mas mataas yung chance na ma-retain lang yung blood natin dun sa part nung veins na yon. And another factor pa na nag-contribute sa mga venous disorders is yung pagkakaroon ng lack of muscular contraction. And next is the damage to intima or endothelium. Syempre, kapag nagkaroon tayo ng scar due to surgery, or injury caused scar that may hinder proper contraction ng vein, kapag nagkaroon ng scar dun sa specific vein na yun, syempre, mai-impaired na rin yung kanyang capability para mag-constrict. Hindi na siya magko-constrict or magko-contract kasi nga may scar na siya. So, kapag hindi na siya nakapag-contract, hindi na rin siya makakatulong mag-squeeze ng blood back papunta sa ating heart. And next is incompetent valves. So, kapag hindi nagko-close o nagbubukas ng maayos yung valves ng ating heart, syempre, halimbawa, hindi nagbubukas na maayos. So, hindi makakapasok yung blood na pabalik do sa ating heart. Ang tendency ay magre-retain lang yung blood na yon do sa specific part ng ating veins. So, yung pressure ng blood is naiipon lang dun. Hindi kasi siya makabalik dun sa heart natin kasi yung valve is hindi nagbubukas or nagko-close ng maayos. Then next is the risk factors. First dyan is yung immobility. So, syempre kapag hindi tayo masyado nagkagagalaw, so hindi rin dumadaloy na maayos yung blood natin. Next is venostasis, vessel trauma, oral contraceptive, kasi yung oral contraceptive, nakaka-apekto yan sa blood clotting by increasing plasma fibrinogen and the activity of coagulation factors. Next is obesity. So, bakit isa ito sa mga risk factors? Syempre, kapag obese ang isang tao, yung pressure from extra body fat squeezes the walls of the veins, and yun yung magdadamage do sa mga delicate valves na nagkikip do sa ating blood para mag-flow mula dun sa ating extremities pabalik sa ating heart. And last is pregnancy, kasi kapag buntis ang isang tao, syempre enlarge yung gravid uterus. And yung gravid uterus na yun ay nag-obstruct do sa pelvic venous outflow kasi naiipit din yung mga veins na malapit do sa may uterus. And next is yung pelvic surgery. Kasi nga, kapag nag-undergo ng surgery ng isang tao at na-damage yung veins, may impaired na rin or matadamage yung contractility ng veins na yun, and hindi na siya mag-squeeze ng blood kasi nga may scar na siya. Next is, under the venous disorders, we have thrombophlebitis or yung inflammation of the vein. Yan, nakikita niyo naman. And next is the deep vein thrombosis or DVT. Yan, thrombophlebitis associated with clot formation. So, yung thrombophlebitis na yan yung katulad dun sa nauna, kapag nag-inflamed yung vein, syempre pag nag-inflamed yung vein, constricted na or makipot na yung daanan ng blood natin. And kapag makipot na yung daanan ng blood natin, hindi na siya mag-aanong makakadaan doon. And yung blood na yon, lahat ng pressure do sa blood na yun is mariretain lang doon sa specific part ng ating vein. While yan namang deep vein thrombosis na yan pwede yan mangyari kapag nagkaroon ng clot formation. Syempre, kapag nagkaroon ng clot formation, obstruction yun doon and haharang yun doon and may impaired niya yung normal blood flow. Sisikip yung daan kasi may nakabara. And next is the venous thromboembolism or VTE. It is DVT associated with pulmonary embolism. So, syempre, kapag nagkaroon tayo ng deep vein thrombosis, ang kasunod na niyan is yung venous thromboembolism. Kasi from the clot na na-formed, pwedeng may isang fragment na humiwalay dun and mag-travel through our brain. And yun na yung magkukos ng thromboembolism sa different parts of our body, such as yung pulmonary embolism, pwede rin mag-travel siya sa papunta sa may kidney, sa brain, and sa gastrointestinal. So next is the varicose veins. It occurs when veins in lower extremities become dilated and congested, which increase hydrostatic pressure and tortuous as a result of weakness of valves or loss of elasticity of vessel walls. So, yan nga, yung varicose vein. So marami naman siguro sa inyo nakakita na nung may mga, lalo sa mga babae, may mga malalaking ugat sa binte or sa hita, sa may paa. So, nangyayari yan due to increased hydrostatic pressure. Kasi nga, kapag halimbawa, yung isang tao, halimbawa ay isang babae ay nagbuntis. So, sa sobrang laki ng uterus niya, do sa gravid uterus, naiipit yung veins and hindi gaano nakakadaan yung blood pabalik papunta sa heart. And nare-retain lang siya doon. Lahat ng hydrostatic pressure is naiipon lang doon and ang tendency kapag sa sobrang tagal na prolonged na yung hydrostatic pressure is naiipon doon, ang tendency lalaki din yung veins na yon. Kaya parang ang itsura niya parang nakausbod siya. Naka-elevate na doon sa skin. So, yan. Isa sa mga cause niyan is yung pregnancy. And pwede rin na kapag mayroong weakness of valves, katulad na sinabi ko kanina, kapag hindi nag-o-open or nag-close ng maayos yung valves, pabalik dun sa heart natin, hindi rin makakadaan ng maayos yung blood and mariretain din yun dun sa specific part ng vein natin. Again, maiipon na naman si hydrostatic pressure doon. And next is loss of elasticity of vessel walls. So, syempre, kapag gulan ng masyadong elasticity ang vessel walls, less na rin yung capability niya para i-squeeze si blood pabalik dun kay heart. Next ay yan yung prolonged standing. Katulad nga, syempre, kapag antagal mo maghapon ka halos nakatayo, yung gravity, syempre, yung blood natin is kapag matagal ka nakatayo, yung blood natin is lagi lang andun sa lower extremities natin. So, kapag andun lagi sa lower extremities natin doon, syempre, yung mga veins natin doon sa lower extremities is siya yung halos sumasalo lahat ng hydrostatic pressure na naiipon. And yung veins na andun, kapag prolonged nga, yung hydrostatic pressure na andun, mag-enlarge na naman yung veins na andun. And doon na mangyayari yung pagkakaroon ng varicose veins. Next is leg trauma. Syempre, kapag nagkaroon ng leg trauma ay na-damage yung veins, magkaroon ng scar, mawawala na naman si elasticity. And next is thrombophlebitis. So, kapag nagkaroon na naman ng thrombophlebitis o yung inflammation ng veins, syempre, hindi man masyado makadaan si blood kasi inflamed siya, nakipot na. So, yun, mariretain na naman yung blood and hindi na makakadaan ng masyado si blood para makabalik papunta kay heart. Next is the clinical findings for peripheral arterial disorders. So, ano nga ba yung mga nararamdaman ng mga patients with peripheral arterial disorder? So, do sa subjective data is paresthesia o yung pamumanhid. Yun yung parang may tinutusok-tusok ng karayom at hindi na makaramdam. Next is aching to severe or burning pain, lower extremity pain with exercise, or intermittent claudication. For the objective data naman, meron tayong pallor or dependent rubor, shiny cool skin, hair loss, thickened nails, gangrenous ulcers of toes or heel, diminished or absent pulses, and decreased ankles brachial index. So, syempre, magkakaroon talaga ng pallor kung decreased na yung blood flow do sa specific part ng ating um, part ng katawan. And mayroon na ring cool skin kasi syempre nga katulad ng sinabi ko, mahalaga ang function ng blood sa pag-maintain ng ating temperature. And meron ding diminished or absent pulses. Syempre kung hindi man nakakadaloy na maayos yung blood, syempre hindi na rin natin madedetect yung pulse na andun kasi nga merong nakabarang clot. And meron na ring gangrenous or ulcers of toes or heel. So, kasi nga kapag prolonged na yung lack of oxygen or ischemia, maglilid na yun doon sa death of muscle or yung necrosis. Next naman is the clinical findings from thrombophlebitis or DVT. The first is for the subjective data. So, patient may be asymptomatic until embolus is released and occludes organ. Calf pain on dorsiflexion of ankle or yung natawag nating human sign. It is not a reliable indicator, so kailangan pa rin nating mag-undergo ng certain diagnosis na maaring mapatunayan kung yun ba ay kung meron ba tayong thrombophlebitis talaga or yun ay DVT. So this sign should not be elicited because dorsiflexion may dislodge the thrombus. For the objective data naman, ang pwede natin makita sa mga patients with thrombophlebitis or DVT is they have edema of one leg. Next is redness and warmth of area along the vein. Kasi nga kung may inflammation, syempre, normally magkakaroon ng warmth doon. And kapag nagkaroon ng Doppler studies or flow studies to sa lower extremities, maaring malaman natin na may decreased flow doon kapag wala tayong pulse na na-detect do sa Doppler study. And then, suggesting thrombus formation, positive D-dimer assay, which indicates products of fibrin degradation in the blood. Next is for the clinical findings of varicose veins. So, for the subjective data naman ng varicose veins, so, ang nararamdaman karaniwan ng mga patients na meron yan is yung pagkakaroon ng heaviness and fatigue in legs with cramping, usually relieved when legs are elevated. Yan. So, karaniwan nga yung mga buntis ay ang ina-advise natin sila na i-elevate nila yung kanilang binti kasi maaari silang maka-experience ng cramping. Kasi nga, katulad na sinabi ko, naiipit yung veins. Naiipit siya gawa nung enlarged na uterus. So, marirelieve yun kapag in-elevate yung legs natin kasi mas mapapabilis or matutulungan yung blood na makabalik papunta sa ating heart. So, kapag in-elevate natin yun at naka-flow sila ng maayos pabalik sa heart, mababawasan din yung hydrostatic pressure na naiipon do sa lower extremities natin na siyang nagkukos ng heaviness and fatigue as well as yung cramping. So, for the objective data naman para sa varicose veins is yung positive venogram, positive Trendelenburg test is a diagnostic of varicose veins. So, yung mayroon ding brown skin discoloration from breakdown of hemoglobin and deposition of ferrous sulfate. Edema, staph ulcers usually develop around ankles and calf from venous insufficiency. So, yan, yung mga objective data na yan is maaari yan makuha kapag nag-undergo yung isang pasyente ng, kapag nag-positive siya sa Trendelenburg test. Yun yung pinakapangunahing test para sa mga patient na nais silang malaman kung meron ba silang varicose veins or mga venous disorders. Next is the therapeutic intervention for peripheral vascular disease. So, syempre, unang-una dyan is yung arterial vasodilators and antiplatelet agents. So, kinakailangan natin na ngayon ng vasodilators para ma-relax yung mga smooth muscles ng ating arteries or veins para makadaloy na maayos yung blood. And syempre, antiplatelet agents para para naman dun sa blood clot na present dun sa ating specific artery or veins. Then, next is the sympathectomy to severe sympathetic ganglia supplying the area. There is local vasodilation with improved circulation. So, dito naman, maaari din tayong gumamit ng bypass grafting. Yan dyan, pwede rin halimbawa kumuha ng artery or veins do sa may mammary natin, sa may, or kaya do sa may saphenous veins, and siyang pwedeng ipalit dun sa vein na hindi na nagpa-function. Para naman yung kasunod na vein is madaluyan na ng blood. Kasi hindi naman natin pwedeng hayaan na hindi naman natin pwedeng hayaan na lang na yung part na yun is hindi natin mapapadaluyan ng dugo. Kailangan natin gawan ng paraan kasi nga kapag hindi inadaluyan ng dugo yun is magkukos ng further damage do sa mga area na hindi nadadatnan ng dugo and oxygen. Next is the amputation of vascular supply is if severely impaired. So, ito namang amputation na ito is last resort na halimbawa kapag yung vascular supply is severely impaired na talaga and hindi na kayang madala ng mga medications and other surgery. Next therapeutic intervention for varicose veins is sclerotherapy. Yung sclerotherapy na yan is yun yung mag-inject ng chemical irritant into vein. So, dalawa ang target niya sclerotherapy na yan. Maaring yung blood clot or yung irritant dun sa ating vein para siya ay mag-dilate. Next is surgical intervention or ligation of vein above the varicosity and removal of the involved vein. So, kapag hindi talaga kaya madala ng medication, so, kakailangan na nating i-remove yung involved na vein dun sa part na yun. Next is the great saphenous vein may be ligated near the femoral junction or deep veins must be able to accommodate venous flow. Early ambulation to prevent formation of thrombus. So, the therapeutic intervention naman for thrombophlebitis is yung prophylactic intervention, such as yung mga anti-embolism, stockings, and exercise to promote venous returns. Next is moist heat to promote vasodilation. Kasi nga, 'di ba, yung cold is nagpo-promote siya ng constriction, while on the other hand, yung heat naman is nagpo-promote siya ng vasodilation. So, kapag thrombophlebitis ang problem natin, mostly ang kailangan natin dyan is yung moist heat para ma-promote yung vasodilation and will therefore promote increased blood flow. Next is elevation of extremity to reduce edema. Another is anticoagulants to prevent recurrence, lalong-lalo na nung mga blood clot na nagkukos ng impaired blood flow do sa specific part na yon. And another is vasodilators to prevent vascular spasm, thrombolytic therapy to dissolve clot, and of course, transvenous filter or thrombectomy. So, dito naman tayo sa nursing care of clients with vascular disease. First dyan is yung assessment and analysis. So, under nyan, we must assess yung risk factors and subjective data. So, tanungin natin, kailan po ba sumasakit yung binti ninyo? Madalas po ba sumasakit yung binti ninyo? Or, para malaman natin, kasi yun na magsiserve as our baseline data para magkaroon tayo ng proper diagnosis and maklasify natin sila kung saan ba silang classification under vascular diseases pwedeng i-consider. And next, kailangan din nating i-assess yung affected extremity for pulses, color, temperature, and circumference. A Doppler scan facilitates attainment of peripheral pulses. Then, mobility of involved extremity. So, kailangan natin sabihin natin sa pasyente kung pwede niyang igalaw yon, kasi doon natin madedetermine kung gaano ka-severe yung kanyang situation. Next is the planning and implementation. First, observe for signs of vascular impairment such as yung pallor, cyanosis, coolness of involved extremities, and amplitude and symmetry of peripheral pulses. So, syempre, halimbawa, nagsagawa tayo ng Doppler study or ng Doppler scan, and nakita natin na mas malakas yung pulse dun sa kabilang part and mahina yung pulse na nakita natin dun sa kabila, then madedetermine natin na merong impaired blood flow dun sa part na yun. And magagamit natin yun para mahanap kung saang part may problem. Next is instruct to avoid cigarette smoking because nicotine constrict vessels. So yan, kailangan natin silang i-instruct na wag itigil na ang panigarilyo kasi nga yung nicotine, especially yung nicotine na ando sa cigarette smoke, is napaka-harmful talaga niyan. So katulad niyan, yung nicotine daw, nagko-constrict daw siya ng vessels, and kung may inflammation na nga yung veins ng patient na may thrombophlebitis and naninigarilyo pa siya, so mas madodouble up yung pagko-constrict ng vessels niya, and mas madodouble up din syempre yung decrease ng blood flow. So, kailangan din natin silang i-avoid na i-massage yung legs na affected kasi mas matitrigger lang yung pagkakaroon ng pain. Hindi siya kailangang i-massage. Maintaining one position for long periods. So, yan, kailangan din natin silang i-instruct na i-avoid yung position, yung isang position for long period. So, kinakailangan syempre gumalaw-gulaw naman tayo para dumaloy ng maayos yung dugo. Hindi yung nakaupo na lang tayo maghapon, nakahiga na lang maghapon. So, hindi na masyado dadaloy ng maayos yung dugo. So, kinakailangan, mahalaga talaga na gumalaw-galaw naman tayo, maglakad-lakad, or baguhin yung position natin. Hindi yung isang position lang. And syempre, wag tayo magsusuot ng mga damit na sobrang higpit kasi nga kung mahigpit yung damit natin, naiipit din syempre yung mga veins natin. And kapag naiipit yung veins natin, hindi gaanong dumadalo yung dugo natin pabalik kay heart. Next is reduce weight. So, magbawas-bawas tayo ng timbang para hindi tayo maging obese kasi nga, yung mga obese na person is yung mga excess fat ay naiipit yung veins natin. And again, hindi na naman dadaloy na maayos kasi nga naiipit yung veins. And perform ankle exercises. So, muscle contractions prevent venous stasis. Next is venous insufficiency. So, kailangan natin i-elevate yung legs to limit edema. Apply anti-embolism stockings before arising and apply sequential compression device for clients on prescribed bed rest. If thrombophlebitis is suspected, maintain bed rest and notify healthcare provider. Next naman dyan, dun sa ating planning and implementation, arterial insufficiency, kung ang problem naman is dun sa artery, so kinakailangang keep extremities warm, para nga, kasi nga yung moist warm, it promotes vasodilation. Then, instruct to wear gloves when exposed to cold, kasi nga yung cold is nagpo-promote yan ng constriction, and hindi pwedeng magkaroon ng constriction ang arteries natin sa mga patient na mayroong vascular disease. And apply lubricant to keep skin supple. Maintain dependent position of extremities to increase arterial flow and limit pain. Next, observe for clinical manifestation of thrombophlebitis and pulmonary embolism such as sudden chest pain, cyanosis, hemoptysis, and shock. Maintain client on bed rest and notify healthcare provider if thrombophlebitis or pulmonary embolism is suspected. So, kinakailangan talaga nating i-report agad yan kapag thrombophlebitis na and pulmonary embolism na ang usapan. Kasi nga, pag may pulmonary embolism, impaired na yung flow ng oxygen sa ating katawan kasi may nakabarang blood clot dun sa may vein doon na papunta sa ating pulmonary. And kailangan maagapan agad yun. Next is provide specific care if undergoing vascular surgery. So, kailangan nating i-monitor for hemorrhage and notify healthcare provider kapag may bleeding and assess neurovascular status of extremity. Keep extremity elevated in immediate post-operative period and allow out of bed as ordered. Next, provide specific care after vein ligation. Elevate foot of the bed for first 24 hours and observe first signs of hemorrhage and maintain compression dressings. And of course, we must assist them with ambulation. Next, provide specific care after endarterectomy and bypass grafting. So, kapag nag-undergo sila ng bypass grafting, i-assess natin yung circulation of involved area by checking pulses, capillary refill, color, temperature, mobility, and sensory function. Kailangan din nating i-monitor yung BP nila because hypotension increases possibility of thrombospermation. Encourage natin sila to increase hydration, to maintain blood volume, and decrease viscosity. Next, observe for signs and hemorrhage and pain, changes in skin color, alteration of vital signs, and ambulate as ordered. Sitting should be avoided kasi nga kapag nakaupo, maaring may mga veins dyan na naiipit so hindi na naman dadalo yung blood pabalik kay heart. And lastly, administer prescribed medications. And last, for the nursing care of clients with vascular disease is the evaluation or desired outcome. So, ito yung dapat natin makita pagtapos nating i-implement yung mga interventions na ginawa natin sa mga patients with vascular disease. So, dapat maintained na yung tissue perfusion and the patient verbalizes reduction in pain. So, that is all for my report and thank you for listening.